President Trump floated a theory that by April, when it warms up, miraculously the coronavirus may go away.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape.
I think it's dangerous for any of us in public life to pretend to replace the doctors who know best and to put out theories that might, in fact, cause people to underestimate the problem.
Bring us up to date on where we are in New York City with preparation and prevention for the novel coronavirus.
We do not know exactly how people get this. We don't know the full effect of it. But I'll tell you something, we have an extraordinary public health apparatus here in New York City. And what became clear to me was it was really about telling the people of our city, this is something we can handle, but you got to follow some basic rules.
We checked in with those health officials to see how the looming threat of a coronavirus outbreak has affected their day-to-day responsibilities. What does the average New Yorker need to know about the coronavirus here and now?
The risk to New Yorkers is still very low, but the city is prepared and very prepared to respond if it escalates. The president put out a proclamation to quarantine all individuals coming in from the Hubei province for 14 days, and then the rest of mainland China, they would be doing in-home quarantine. And what I have been doing to support the Department of Health with this is we have identified a quarantine facility where we can transport passengers. And then we've put together and helped devise a plan to support all the wraparound services, laundry, feeding, anything that they might need while they're in that quarantine situation.
Our next stop was the esteemed Bellevue Hospital Center, where we learned about the differences and similarities between coronavirus and traditional strains of influenza.
The coronavirus is part of a family of known viruses. There are 4 strains that we see commonly here in New York City and across the country that cause the flu, and that the symptoms can be very familiar. If you've had travel to the affected areas in China and you're not feeling well and you've returned within the last 14 days, call your healthcare provider and get tested.
What does the mask do? Is it protecting the person, and how does it do that?
Having a mask in place doesn't protect them, but it keeps them from spreading the virus to others.
How are you helping New Yorkers prevent the stigma that is attached to this infection?
This outbreak is because of a virus. It's not because of a group of people. Fear is not an excuse for spreading bigotry and spreading misinformation.
Finally, we spoke to special pathogen expert Dr. Madad, who discussed how government support, or the lack thereof, affects research, response, and treatment for outbreaks. China locked down a lot of its borders, and the United States is doing that to a certain extent. What's the logic there? Will that work?
Historically, we've seen that these types of travel bans and restrictions have not worked, because one of the things that we don't want to do is take away the public trust. And so if folks are fearful of coming forward, it gets harder for public health to do any contact tracing.
Tell us a little bit about antiviral medications that could treat the disease, perhaps, but aren't readily available, certainly for the coronavirus.
Unfortunately, it's one of those games of, is there a market for it? There's a big hype in the beginning, and then it dissipates. And so there needs to be political will, and there needs to be financial support.
Could we prevent future epidemics, future special pathogens?
So these types of events are natural, but what we can do is, if we invest in them, we can lower the human toll, the economic toll, and the social toll that it takes on just countries in general. And we're able to respond faster, better, and more efficiently.
This should not stop you from going about your life, should not stop you from going to Chinatown and going out to eat. I'm going to do that today myself. Until we know fully how to handle this virus, we have to assume it'll be with us for a long time. We have to assume it may throw curveballs at us, and be in a vigilant state as a city, as a nation, until this crisis is over.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.